Hi, everyone. My name is Dana Cameron. I am the Client Services Manager here at Vantage Aging. For Caregiver Solutions this month, we have Elizabeth England here from the KAZ Company. Liz is a licensed and certified agent at the KAZ Company. Prior to joining the KAZ Company, Liz worked at several companies within corporate health and wellness as an employee benefits professional. Her primary responsibilities included benefit strategy, design, pricing, and data analysis. Liz is a lifelong resident of Akron, Ohio. She graduated from the University of Akron with an associate degree in business management technology and a bachelor's degree in business and organizational communications. Liz has also earned several certifications in human resources, wellness, and Medicare. Liz also serves on the board of directors for the Alzheimer's Association, Grace House Akron, Vantage Aging, and several community nonprofit boards. Liz is a graduate of Leadership Akron Next. She also serves on the City of Akron Human Resources Commission, HRC. As a boomer, senior, and retiree, Liz has expanded her career to work in the healthcare insurance industry, focusing on Medicare plans at the KAZ Company. Welcome, Liz.
Well, welcome. Thank you so much, Dana.
You're welcome.
Thank you for that introduction. And so, hello, everyone. Thank you for joining us today. And we're going to talk about Medicare, what it is not, and then some tips for caregivers and also for people that are currently on Medicare. All right. So, let's get started. As Dana mentioned, I am a licensed and certified agent. I work with the KAZ Company, and we say, ask us about the maze. I'm here because we can help you navigate through the Medicare maze. And so anybody that knows anything about Medicare, they know it is definitely an insurance maze. So today we'll be focusing on three things: Medicare supplements, Medicare Advantage plans, and Medicare Part D prescription drug plans. So there we go. So the key takeaways from the presentation. So I just really want you to know the basics of Medicare. Everybody's telling you what Medicare is and everything, but I want you to get it for me that these are the basics. And so what we'll talk about is what Medicare covers, what it doesn't cover, right? And how you can fill in the gaps. And also I have a few slides on resources for caregivers. So this is the most important slide right here. This is Medicare, the A, B, C, and D's of Medicare. All right. So you have Part, P-A-R-T. Part A covers hospital, skilled nursing, hospice, right? There are, tell my clients, Medicare is not free. Everybody think, oh, I thought it was free. Medicare is not free. And let me just give you a definition of Medicare. So Medicare is a federal health insurance program for people 65 and older. There are no pre-existing condition clauses or anything. Once you turn 65, you're eligible for Medicare. And then you're eligible for original Medicare, Part A and Part B. So Part A covers hospital, skilled nursing, and hospice. There are deductibles and co-insurance. That's where I remembered to tell you Medicare is not free. So you go to the hospital, you'll pay 20% of the hospital cost. Medicare would pay 80%. You can receive it at age 65 or sooner due to a disability. So if you've been on Social Security disability for 24 months, no matter what age you are, they will enroll you into Medicare on the 25th month. But for everybody else, you need to work at least 40 quarters to get premium free Part A. Now, Part B covers doctor visits, hospital lab tests, those kind of things. There are deductibles and co-insurance because Medicare is not free. It is an 80%, 20% plan. There is a monthly premium for Part B that everybody has to pay. Right now, it's $185. It's based on your income from 2 years ago, and I do have a chart that'll show you. Now, I don't tell you what your Part B premium is going to be. The Social Security Administration office will tell you. And that's where you go to apply for Medicare, believe it or not. So Social Security Administration administers Medicare. So you go to the Social Security office to sign up for Medicare, Part A, Part B, Original Medicare, right? You can pay your Part B premium out of your Social Security check if you're collecting your Social Security benefits. I have nothing to do with Social Security benefits. You work directly with the Social Security Administration on that as well. But you can see how they intertwine here, and that's why people get confused. But that's why we're here to help you navigate through the Medicare maze. So when you get after you get original Medicare Part A, Part B, and then you go, well, Liz, that 80/20 plan doesn't sound too good. Where can I get additional coverage? Well, you can get additional coverage with a Part C plan, Medicare Part C Advantage Plan. It combines your Part A and your Part B and your Part D all into one plan. It's you pay co-insurances versus I'm sorry, you pay co-pays versus co-insurance, and they have what's known as your maximum out of pocket, and that's to protect you from bankruptcy and catastrophic claims. So depending on the plan, I represent 10 different insurance companies, and there's multiple plans, and you got to know who your doctor and all that stuff is, but just let's just stick with here what A, B, C, and D means. Now, Part D is its own federal insurance program, Part D. So when you get A and B, you still won't have D. You have to apply for D, Part D. And Part D, D for drugs, that's your prescription drug plan. And so, not all seniors, but bulk of seniors are on some type of medication. And that's covered under the prescription drug plan. So all the prescription drug plans have a formulary, which is nothing more than a drug list of your medications that are covered under that plan. The medications are put in tiers 1 through 5, and they assign a cost to that. So generics are usually zero copay. Your tier 3 are going to be, $40, $50 copay a month. There is a penalty for not joining when you're eligible. Excuse me, I have clients that say, well, I don't take any drugs. Okay, but if you don't sign up when you're first eligible, then you'll be assessed a penalty later. So just another one of those connect the dot type things with Medicare. All right. So remember I told you that there is a premium for Medicare Part B? There's also one for Part D, but we'll just do Part B, B for boy. And it's based on your income from 2 years ago. And you go, oh, I don't know what I made 2 years ago. Don't worry. They got a friend called the IRS. The IRS will tell them how much you earned 2 years ago, just in case you can't remember. That's why they handle all that. I don't do anything with that. But your income from 2 years ago, whether you filed individual or joint, married, blah, 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 here's a chart. And so on average, most people, if they earn $106,000 or less, they pay $185 per month for their Part B premium. So you have to have original Medicare, Part A, Part B. This is your Part B premium. Now, I do have some high income earners, all right, just making over $200,000, $500,000 a year. This is what they pay every month, and they are not happy. They are not happy at all. It's the same Part B program that I have that they would have, but they pay more. It's called the income related monthly adjustment amount. So, I mean, you can't feel too bad for them. They made $500,000, but this is each. So if it's a couple, each one of them will pay $628. So I always give this chart. I give this chart to all my clients when I first meet with you and we start talking about Medicare, because I want you to know, what it's going to cost you to sign up and have Medicare. So that's a nice little chart. This amount keeps going up. I remember when it was $143. Now it's $185. Goes up every year on average. Okay, so remember I said you had original Medicare Part A, Part B. And you said, Liz, how can I get some additional coverage? Right? you have two options. You got option one, which is a Medicare sup plan and a standalone prescription drug plan, or you got option two, a Medicare Advantage plan. And we're going to talk about these very high level, what they are, so you at least have an idea. They're both Medicare supplement plans, okay? But just to distinguish between the two, we call the Medicare sup option one, we call that the Medigap plan because it fills in the gaps from original Medicare. All right. So here we go. Option one, your Medicare supplement plan. It's additional coverage beyond the original Medicare, right? It reduces your deductible, co-pays, and co-insurance. So that 20% that I was telling you about, it'll pick up that 20%. That's why it's a Medigap plan, right? They're standardized plans A through N. And when I say standardized, a Medigap plan in Ohio is the same plan that's in Michigan or Florida. Um, Standardized A through N. The most popular one right now is a Plan G. So if you get a Plan G in Ohio, it's the same plan in Michigan or Florida or whatever. They're offered through insurance companies. Now, everybody loves a Medigap plan because you have the freedom to choose any doctor or hospital in the United States that accepts Medicare. And 99.9% of all doctors accept Medicare, right? So if you don't want to deal with a network, then this is the kind of, well, this is the plan that you would be looking at. However, there is a monthly premium for this plan, right? So you're paying your 185 and then you're going to pay another 125, 150 for this plan. I tell my clients, I don't count your money. Whatever you want, I'm there for you. Okay. I'm giving you all the pros and the cons. You make a decision. It has to be your decision, not my decision. So everybody loves it because you have the freedom to choose any doc. And this is all across the United States, right? Does not include the drug plan. So you got to get a standalone prescription drug plan, which would be another $20, $25. So if you do the math, that's what I tell them, you got to do the math, and that's what this type of plan would cost you. Here's the Part D, would be a standalone if you do the Medigap, or if you do the Advantage plan, it's included in there. All right. Either way, the Part D plan has a formulary and it has pharmacies that are in the network. They're offered by private insurance companies, and it's not free either. You'll pay a premium, you pay co-pays when you go pick up your prescriptions. It has deductibles. It's an insurance plan, you know. So how we determine what plan is right for you is I need a list of your medications. And then I run a drug list and see if it's covered or not covered. All right. Now, the Medicare Advantage plans. So you got option one over there, Medigap. This is option two. It's a Medicare Advantage plan. So it helps covers your hospital costs, your doctor visits, and other medical services. I need to mention that these insurance companies, they have a contract with Medicare. So Medicare says, hey, insurance carrier XYZ, put this plan together. We'll pay you X number of dollars a month, and you provide benefits for our Medicare beneficiaries. So you give them all their Part A benefits, you give them all their Part B benefits, you give them extra benefits, and we'll give you money so that you can do that. All right. Because let's face it, $185 is not going to pay for your health insurance, you know. So where's this money coming from? It's coming from the federal government. So and so it covers your hospital costs, doctor visits, other medical services. You can get one with the Part D already built in. So it's a Medicare Advantage with prescription drug plan. It has premiums. Now, one thing I forgot to mention on the other slide. The plan premiums are not based on your age or gender. That Medigap plan that we just talked about is based on your age and your gender. So an age 65-year-old female, an 80-year-old male, and there's a chart, and they tell you how much your monthly premium will be. But with the Advantage plan, it doesn't matter. Your age doesn't matter, or your gender. So it combines all the benefits and services into one plan, and you get additional benefits. So you may have noticed that I haven't said anything about dental, vision, or hearing because Medicare, original Medicare, does not cover dental, vision, or hearing. So if you get that Medigap plan, you're still going to have to purchase a standalone dental, vision, hearing plan if you want those benefits. And that's another premium. All right. But with an Advantage plan, you get all your Part A, all your Part B, and Part D, and additional benefits like dental, vision, hearing, all into one plan. And a lot of these plans is a 0 monthly premium. Okay, you still got to pay your Part B. The rest are 0 monthly premiums, and you have copays, right? And they come into two different options: an HMO, which is a health maintenance organization, or a PPO, which is a preferred provider organization. So these are networks. These are managed care networks. And that's where we would need to make sure your doctors are in the network. Most doctors are in multiple plans. Cleveland Clinic is in all the plans, I do believe. So it's not an issue finding providers in the network, but this is something we do at the time, when you're looking to sign up for a plan. Okay, so who to be eligible? You have to be enrolled in Medicare Part A, Part B, right? And you have to live in the service area. Plain and simple. So if you move from Ohio to Michigan, then we'd have to change your plan through a special enrollment period because you would be outside of your service area, right? So just so you know that you can make a change. Okay, now last year prescription drug coverage was all we did last year because the Inflation Reduction Act came into existence effective January 1st of 2025, right? So I'm doing road trips. I'm telling everybody, and it was a great thing. It is a great thing. Okay. Prescription drug coverage, right? So a lot of the plans have a deductible. Some do, some don't. All right. That's the first stage. And then you have your initial coverage stage. All right. In this stage, you'll pay a copay or co-insurance, and you will pay no more than $2,000 for the year. And then you move into the catastrophic, and then that's the 0. So before this change, that used to be $8,000. So people were like, it was the first change in 15 years. It was a lot of money. It was a lot of money. So now it's only, not only, but $2,000 maximum out of your pocket for covered medications. All right. And there's the catastrophic where you won't pay anything. All right. So this slide right here kind of explains it. So it just started this year, the Inflation Reduction Act. People with Part D, you'll pay no more than a certain amount out of pocket for prescriptions. And 2025, as I mentioned, is $2,000. I will imagine it's going to go up every year, be indexed, cost of living, those kind of things. It'll probably go up, but right now it's 2025. And I mentioned drastically lowered from the maximum of $8,000, right? And it completely eliminated the coverage gap, which was known as the donut hole. And everybody was like happy, happy, happy. This was a really good thing. I was glad to be able to share that with people. Oh, then the other thing with the Inflation Reduction Act is they put together a prescription payment plan option. Ooh. So if you have high cost drugs and you can't afford to pay for all that, pay for your medications at that time at point of sale, well, you can sign up for a monthly installment plan, right? And you sign up with your carrier. You can do it anytime during the year. So if you're listening to this now and you like, wow, I could have used that. No, you can still use this. You just need to contact your carrier and tell them you want to get information on the prescription drug payment plan option. So what they do, they take your total drug cost and they divide it by 12. Well, now they'll divide it by 6 because half the year is over. So, they take it to the end of the year. So members with drug costs of about $600 are likely to benefit. So if you got zero cost medications or very low cost, it doesn't make any sense to go on a payment plan. You can probably afford that at the time of purchase. But if you have high cost drugs, and believe me, there are some high cost drugs out there, you might want it. I call them life saving medications, right? Um, you might want to go on a payment plan. So just check with the plan that you're with. They have all these acronyms, Medicare payment, prescription plan, and M3P. But what's important when we're doing through all the training, it changes the timing of the payment, not the cost of the medications. So if you got a $600 drug, you can spread it out over 6 months. It doesn't change the cost, but it changed the timing of the payment, and for some people that is helpful. Okay, here's a nice diagram on prescription drugs. So a formulary is nothing more than a drug list. All right. So there are there's all kinds of FDA approved drugs. All right. And they're grouped by what they do. So if you have high blood pressure, there's drugs for that. If you got diabetes, there's drugs for that. So it's a bunch of them, right? So each health plan puts together a formulary, right? And they have to have at least 2 medications out of each therapeutic class to offer their members. All right. And then they assign a cost to it for that particular drug. So your tier ones, which are your generics, preferred generics, you can see they're pretty low cost. Um, a tier 3 would be a name brand drug, the ones you see on the commercials. Those are generally not name brand drugs and no generic available. All right. So it's a tier 3. You got to pay what the cost is from the manufacturer. Tier 4, non-preferred. Tier 5. Now these are the specialty drugs. These are those life-saving bloodborne medication drugs, injectables, those kind of things. Thousands of dollars for those. But thank God you have a prescription drug plan, and now you've got that max of $2,000 versus $8,000. So it's all good. It's all good. So the changes for the Inflation Reduction Act are in effect right now. Okay. Last year they said they were going to send out a mid-year statement. So if you're on a Medicare Advantage plan and you get all these benefits, dental, vision, hearing, blah, 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 and you forget that, oh yeah, I still have that. They're supposed to be doing a mid-year statement. I think it got deferred to 2026. But that doesn't mean that you can't call your agent, pull out your book, whatever, and see what benefits you have that you haven't used right now. I have a lot of clients, like when annual enrollment comes around, when I signed them up for the plan, they wanted a lot of dental coverage. Then I talked to them in October. I said, did you go use your dental bet? No, I didn't go. Okay, guess what? It's not being offered the next year. So you've lost that benefit. So I'm always preaching, and I send out reminder cards to review your benefits and take advantage of your benefits. All right. That's why you pick the plan. All right. Also, they're getting more into caregiver benefits. So caregivers for loved ones with dementia may be eligible for respite care. And I think the next slide has that. No, that's not it. That's the mid-year statement. Here we go. So expanded program for family caregiver services. So the program is for dementia patients and their caregivers. You may remember from the introduction, I am on the board for the Alzheimer's Association. And all of this is just kind of coming together. I have clients, I'm talking to clients, and they're talking about their family member or their spouse, and so I'm able to share with them, you need to contact the Alzheimer's Association. they have tons of resources. And I know you guys have had them as a speaker in the past. Can't say enough about them. But this is a new program that's going into effect. Well, it went into effect last year, and it's for patients and caregivers. And it's called Guiding an Improved Dementia Experience Guide. Provides a 24/7 support line, a care navigator, up to 2,500 a year for at home or overnight. Patients in there typically won't have co-payments. So this is good. They're looking to expand it. If you go to the website, it'll tell you where the program is right now. So I went to the website. There's one in Cleveland right now. All right. So just click on the website and you'll see um, where and if there's a program available in your area, but they're looking to expand it. So keep it on your radar. Programs will begin July 2025. Well, that's right around the corner. So if you go to the website, you will see where the program is and if you meet the qualifications. So must be enrolled in original Medicare and have a dementia diagnosis. Can't be in a nursing home. All right. Okay. So just to recap, we talked about original Medicare, Part A, Part B. We talked about how you can get supplemental coverage, a Medigap plan and a prescription drug plan, or a Medicare Part C Advantage plan. All right. Medicare plans are on a calendar year basis, January 1st through December 31st. So the plan you have right now, that's the time frame. Obviously, people get into Medicare when they turn 65 or retire or those kind of things. So if you're working with someone that has Medicare, pull out their card, make sure they have, well, I'm sure they've got Medicare Part A, Part B, but you need to just pay close attention to what insurance carrier they have. I was a caregiver for a friend, and he had one plan, and I make the doctor's appointment, and when we get there, he canceled the appointments. So it's just those kind of frustrations with dealing with someone, and he don't remember making the change. You don't even remember he got the phone call, right? So if you have any questions regarding Medicare, feel free to give me a call. But I'm sure everybody has stories to tell about the people that they're caring for, love them to death. But so this is just overview Medicare. They got it. If you have it, also, some of you may be on the call that on the webinar that have Medicare as well. So this is just a very high level overview of Medicare. Now, I mentioned that Medicare is a calendar year basis, right? So every year in September or October, if you're on Medicare, you're going to get an annual notice of change, annual notice of changes, all right? And I try to get my clients to be on the lookout for it. Everybody gets it. Whoever your insurance carrier is, they are going to send it to you. Usually says important information on the envelope. Most people go, but I still didn't open it. Please open it. Okay, open it. And what it is is a side-by-side comparison of the benefits that you have right now in 2025 compared to what the benefits are going to be in 2026. So insurance companies are working right now trying to figure out what the benefits are going to be for next year. We won't know. Well, we'll know this summer as an agent, but we can't share until the notices go out in October. So you're going to be the first to know what changes are taking effect on the plan that you are enrolled in. I don't get them for all the carriers. I only get mine. All right. But you're going to get one. And I highly recommend you take a look at it. If you have some questions, let me know. But I mean, that's your first um, notice of what the plan is going to look like in 2026, right? And if it's a zero premium now, but they're going to start charging a premium in 2026, you need to know they've sent you the notice. They're just going to automatically implement it unless you make a change. So if you don't make a change, your plan automatically rolls over to next year. No questions asked. And let's not even talk about all the phone calls and the commercials and all that stuff during annual enrollment. Drives me crazy. I'm on Medicare, okay? I get the phone calls, I get the mailings, I get everything you get, right? Drives me crazy. But anyway, that's just Medicare. So look out for your annual notice of change this fall, September, October, right? You should review your plan's annual notice of changes carefully, right? And it's a really easy side by side. This year, next year. It can't make it any simpler, you know, that's what your plan, your changes are going to be for next year. I'm thinking, a lot of people ask me, I know nothing, but so I told you these insurance companies, they have a contract with the government, with the federal government. Well, if the federal government reduces the money they give these insurance companies, then these insurance companies are going to reduce the benefits that you receive. So they have a lot of extra benefits. They're going to probably have to cut back on some things, right? Because they're going to stay in business. So that's why it's going to be very, 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 very important to review your 2026. We saw a glimpse of changes for 2025. I had people calling me and saying, get me out of this plan. So I'm just saying you got to be diligent and make sure you pay attention to your changes. Okay. All right. Now, Medicare. So you just can't get into Medicare anytime you want to, right? You got to have a reason to get in, all right? So they have election periods, right? So you have an initial enrollment period when you turn 65, which is 3 months before your birthday month, and 3 months after. You can get in during your initial enrollment period to avoid any penalties, any late enrollment penalties. If you're still working, then you just want to do Part A. You don't want to do Part B right now at this time. And so that's when you need to speak with somebody about what your options are, because people will tell you, oh, you need to sign up for A and B and D and and you don't. Okay. So talk to a licensed agent, which reminds me, there is no cost or obligation to work with a licensed agent. All right. Why would, we get paid for that? The insurance companies pay as a commission once you enroll in a plan. All right. But other than that, we're the boots on the ground. I do a lot of presentations like this, in person at the library, at companies, whatever, because I want to get the word out. Everybody turns 64 and a half and then they panic because they're starting to get all this information from Medicare and these insurance companies. Actually, not Medicare. Medicare doesn't even tell you. Insurance companies. And they're driving you crazy because every insurance company knows you're turning 65. It is no secret you're turning 65. And they want you to sign up with them because they're going to get a check from the federal government, remember? So they're very aggressive, right? So that's a clue. 64 and a half. You're going to start getting a bunch of mail, phone calls. Somebody said, am I supposed to do something? You think? Yes, you're supposed to do something. Okay. So that's your initial enrollment period. But if you're still working, don't worry about it. Just get Part A. And then we have annual AEP, annual election period. That's in October. That's the craziest time. Everybody on Medicare can make a change. That's why it's all these commercials and everything, because everybody can make a change. So that's October 15th through December 7th. All right. And they have what's known as a special election period. So remember, I used the example that if you moved, so you moved out of the service area, that would be a special election period for you. When you get Part A and you didn't do Part B right now because you're still working, but then you retire, that's a special election period. So you'll have an opportunity to make a change at that time. Now they have this open enrollment period, and it's from January through March 31st. So it's right after AEP. Well, sometimes people might make a change and they say, I really shouldn't have, or I really want to make a change. You kind of get this one-time opportunity if you're doing a Medicare Advantage plan to make this change. All right. It's a one-time only, though. All right. So those are your election periods, which are very important. We, the KAZ Company, we represent multiple carriers. I have a non-residence license in 15 different states. So not only do I have a license here in Ohio, I have a license in Florida and Pennsylvania and North and South Carolina and some other ones. It's nothing to get a non-residence license. You just have to pay a fee. And so I usually get those through referrals. So somebody in Akron has a relative in Pennsylvania, they refer that relative to me, and then that's when I go get a non-residence license, but I already have them. So that's how I ended up with all these non-residence licenses. Here's our team. It's only about 20 of us. Um, so we represent multiple carriers. We're local. You know, some people, I mean, you can sign up for Medicare all on your own. God bless you. But you don't have an agent. You don't have anybody you can call. You know, you're just out there on your own. You know, we're here. We're local. We provide guidance and education through the maze. We help you make an informed decision. Like I said, you have two options, option one or option two. You tell me what you want, and then we can move forward from there. Um, we do appointments face to face, Zoom, phone call. As you can imagine, when the pandemic hit, everything went virtual. That's why I can have these clients in 15 different states. Uh, I work with them, over the phone or Zoom. So it makes it easy. Let's see. So let's get together. I mentioned there's no cost or obligation to meet with me. Any licensed agent, all right? If they try to charge you, you need to get somebody else. One thing about the phone calls, real quick. So these phone calls that you're getting from Medicare sales reps or whatever companies, those are customer service people on the line. All right. So so they're calling you, trying to get you to want to make a change, and then they transfer you to a licensed agent. Because as a licensed agent, I cannot cold call you. I cannot take a list of names and start calling people. I'd lose my license. So they have customer service people that'll call you, and they always ask you a question you're going to say yes to. How would you like to? And you go, yes. They go, okay. Then they transfer you. Then you got to talk to the and I tell my clients, just hang up. Don't even engage them. If you have any questions, call me. What they say they could get me said, no, they can't. They can't get it for you. They might get it for somebody else. You don't qualify. You don't have a chronic condition, say. There's certain things. So they're not lying. They're just not really telling you the full truth. So anyway, and that do not call list, I recommend you get on it. I'm on it, and I still get calls. I just hang up on them. All right. But anyway, here's the number to the KAZ office. And oh Lord, I'm sure you've seen us on TV on Sunday mornings. I hate doing those. But anyway, we're on Spotlight 5 on Sunday mornings and Channel 3 Saturday mornings. I do them every now and then. I don't like doing them. Okay, so here's my contact information. So if you have any questions about anything, feel free to give me a call. As I mentioned, no cost or obligation, and I'd be more than happy to help you. And that's it. I do believe, yes. And thank you. Thank you very much for taking the time. I appreciate it.
Thank you, Liz.
You're
Um,
welcome.
Now I'm going to want to look for you on those programs on Saturday and Sunday mornings now that I have this information.
Yes, yes, it's a
Yes.
Medicare minute.
Oh, okay. I
I'm
think
not
I've
on a
seen
lot
those.
of them. I tell you, I maybe twice a year. I don't like doing them.
I'm sure you do great.
Oh,
Um, I did, thank you for this information. I know I have been to several Medicare seminars and I learn something new every time. It is complicated, but I know that with help of people like you, that it can be less intimidating for individuals who are signing up for it, to
yes.
really know what benefits will be best for them and work best in their life and for their healthcare needs. Um, I always have this question, and it's probably maybe a hard one, I don't know, but about for people who travel every now and
Mhm.
again,
Right.
um, are there specific things that are recommended or advised or things that they should be thinking about?
Okay, very good question. So there, okay, so if you do the Medigap plan, it doesn't matter wherever you go, you're in network. If you do a Medicare Advantage plan, then you have a service area, you have a network, right? So emergency care is always covered in your service area and outside of your service area. So if you travel to Florida and you have an accident, you go to the nearest facility, and you have to pay out of pocket, and when you get back, get reimbursed. But the emergency services are covered. Same thing with urgent care. No matter where you are, you're covered for urgent care. You just go to the nearest urgent care facility.
That is good to know because those service areas, I know when I went to one seminar for Medicare, it was many of them were even county specific.
Yes,
So
they are
that's
county specific.
yeah.
Absolutely.
So that's something to keep in mind for sure.
Abs
Yeah.
absolutely.
Okay. Okay. Um and sorry, I had one more question and I just left my brain. I write questions
Oh,
down so I
yeah.
remember them. Um the dental and vision part with the
Yeah.
Medicare supplement,
Yes.
I had been wondering about that. So, am I to understand Medicare supplements typically don't have any type of dental vision benefit? You're then purchasing a completely separate plan.
You are exactly right. So
Okay.
the Medicare Supplement Medigap plan
Okay.
only covers Part A, Part B, right? And it's
Mm-hmm.
an 80%, 20% plan. So it'll pick up the 20% that you're going to owe,
Mm-hmm.
right? But they don't cover dental, vision, hearing,
Okay.
gym memberships, any of those kind of things. So
Okay.
yes, you would have to purchase a standalone prescription drug. I'm sorry, dental vision plan.
Okay.
Yeah.
Okay. Yeah, that's good to know because
Hmm.
that adds, I'm sure, to the decision making on the cost and everything.
Absolutely. You got to do the math.
Yeah. Yeah. I really appreciate your time and your thorough presentation. As I said, I know this will be helpful to people. I do appreciate your time and your knowledge.
Well, thank you. I appreciate you giving me the opportunity
Of
to
course.
do this. So like here's my contact information. If anybody has any questions at all, feel free to give me a call, and and thank you.
Well, thank you. And thank you to all of you watching. And please join us again when we are back in December. Thank you.
Thank you. Bye-bye.
Bye.